Thank you for joining us for another episode of Your Health Moment. I'm your host, Dr. Fitness, and as always, we're going to be discussing all things holistic health and wellness. And it won't be no different today than any other day, except we have the pleasure of interviewing Erin Souza. Did I pronounce that correct, Erin?
Erin Souza, yes.
Yep, Erin Souza. And we're going to be discussing, uh, you know, let me put it like this. Do you ever wonder if you're getting enough vitamins and minerals for optimum health? Well, Erin is going to answer that question and more. She's going to tell us about vitamins and minerals because Erin is a versatile health expert holding roles as a functional diagnostic nutrition practitioner, board certified holistic health practitioner, registered diet hygiene or dental hygienist. I'm thinking food all the time, so diet just comes to me first. Uh, and a certified mold illness practitioner. As the founder and CEO of EC Restorative, she empowers busy, successful individuals to achieve optimal health and wellness with her unique approach that integrates functional lab testing, lifestyle assessment, and tailored nutrition strategies. Erin specializes in developing personalized protocols that focus on nutrition, movement, stress management, and nervous system support. She's dedicated to guiding clients through their unique health journeys with holistic, data driven methodology. But first, I'd like to thank our sponsor, McGowan Medical's Spinal Rehabilitation Center. If you've been in a car accident, it can be physically and mentally traumatic. At McGowan Spinal Rehabilitation Center, you get first rate care with the latest equipment for your physical trauma, but their kind and caring staff also rehabilitate your mental trauma. So from the accident, you get the best care possible when you go to McGowan Spinal Rehabilitation Centers. If you'd like more information, call 904-350-5544. That's 904-350-5544. Now, I appreciate you joining us, Erin. Why don't we start with you telling us a little about yourself and what you do?
I think you did a really excellent introduction there, Max.
Oh my God, you
I
got to
like
break down. You got to break down some of your really impressive titles of what you do because so many of us are just not are familiar with what's going on where it comes to functional medicine, functional nutrition, and helping people where it comes to getting the right nutrition. So you got to,
Yeah.
yeah.
So, as a functional diagnostic nutrition practitioner, my methodology is very comprehensive and it focuses on identifying and addressing the root cause of health issues rather than just treating symptoms. So, the approach that I take is holistic and it encompasses functional lab testing, nutrition, and evaluation of hormone, immune, digestive, and detoxification systems. And then based on those findings, I am able to customize a healing protocol for my client. My goal is to restore function and balance within our key body systems without using medication. So, I do want to say
Wow.
though that it's not me that's the star of the show. An essential part of what I do is educating my clients about their health, which empowers them to take charge and understand their unique needs in their body so they can maintain their wellness long term.
Oh, wow. So you are teaching them to be independent, their
I
own
am.
enthusiastic, independent health and wellness specialist.
Exactly. I give them the foundations of the education and guide them through the initial healing protocols to bridge those gaps and resolve symptoms. But ultimately, I want them to be their own best doctor.
Can you give me an example of what a healing protocol would look like?
It really depends on the individual. I
Hmm.
always start with addressing drainage pathways, but I use the functional lab tests along with someone's lifestyle history, their medical history to create their custom protocol. So it's very different for everybody, but it does consist of making, small tweaks to their lifestyle habits, getting them moving daily, improving their nutrition, and then matching up customized supplements to fill in those bridges of what they need.
That's pretty cool. Now you mentioned draining protocols. Now all
Drainage
kinds of things
pathways.
popped into my head when you say draining protocols, and I'm like, is it draining? Is it lymph nodes? Is it peeing? Is it
Yeah,
snot coming out your nose? Is it
it's
sweat? What is draining protocols?
it's drainage pathways, actually, not draining protocols.
Oh, I'm
Um,
sorry. Draining pathways. Yeah, help me with
Drainage
that.
pathways. So our drainage pathways consist of things like our colon and our liver,
Oh,
our
oh,
lymph system,
oh.
our brain, our kidneys, our lungs. A lot of times when we have an abundance of toxins in the body, the pathways that our body naturally will release and drain those toxins get clogged. So, in order to make sure that someone has a very easy protocol to go through while we're ridding of the toxins and pathogens, we have to make sure that we open up those pathways first. That's the
Yeah.
very first thing I do with everybody.
So you open up the drainage pathways
Uh-huh.
and the drainage pathways. So there are drainage pathways, I hear you say, in the brain.
There is. There is drainage pathways in the brain.
Now, is the pathways how the body clears what toxins?
It is. Yeah.
Okay.
So a lot of people will get, the word detoxification and drainage confused. Drainage is the actual act of toxins leaving the body, whereas detoxification is actually the kill procedure of, binding up the toxins. So
Mm.
imagine it like our body's kind of like a sewer system.
Yeah. Oh, yeah.
Like
Okay.
everybody knows what going to the bathroom is, and if you have a clogged toilet, right, you're not going to be able to drain everything out. That's kind of like how our body works. You want to clear that out so you can flush things out of the body.
Yeah, I got you. So, like when you have a kidney stone and you can't get your pee out.
Exactly, exactly.
So the
We
kidney stone is blocking the drainage pathway.
Exactly. We know that drainage pathways get blocked when we aren't pooping daily, when we cannot sweat easily. If someone has, skin issues, like whether it be just bumps on the skin, cellulite, um, if they're not peeing regularly. So,
Oh, that's really cool. Because it's funny. This is the first time anyone has really discussed draining pathways. So
really,
I really appreciate this knowledge. Now, we're all like, we're familiar with detoxing and we're familiar with pathways to eliminate waste from our systems.
yeah.
But when we're talking about drainage pathways, what would be a sign that we're having a difficulty with a particular drainage pathway? Just pick any drainage pathway, but if you could give me an example of what would be a symptom that, you know what, I'm having a drainage pathway problem in that area.
So the colon is always where we start. The drainage pathways go in, if you can imagine a upside down triangle, and the colon's at the very bottom. So we start there. If someone is not pooping daily, ideally we want to be pooping at least once a day, if not 2 to 3 times a day. So constipation is probably the easiest one to talk about. I think it's very relatable. A lot of my
Hmm.
clients come to me and they just think it's normal that they're not pooping every day, like, oh, I've only gone every other day or every 2 days my entire life. What's wrong with that? But when we have that stopped up at the very bottom of the triangle there, it kind of backs everything else up and makes everything else stagnant. So I think that's an easy one that most
Oh,
people
yeah,
can
that
relate
totally
to.
makes sense. Okay. So, yep, thank you for that. Now I know more about draining pathways. Now, you had mentioned the difference between draining pathways and detoxification. Can you clarify that, or, if break it down a little bit so that we understand a little bit better about the difference between the detox and the draining? Because everyone gets detox. I mean, they take detoxes, they want to cleanse their body, they get it. There's a lot of ways to do that. But yeah, so
So
detox.
drainage comes first.
Hmm.
Addressing drainage pathways come first, and that's so you can have an easy detoxification. Detoxification is when we're actually going in there and using supplements or using different tools to actually kill off toxins, or rid the body of the toxins. So if we don't address the drainage pathways first before detoxification, this is how people get detox symptoms that you hear about, which are called
Hmm. I
Herx
got you.
symptoms. They can get chills, fever-like symptoms like fevers and body aches. They just have a really hard time going through detox versus when we address those drainage pathways first, we don't
It gets
experience those
easier.
symptoms.
No. Oh my God. That is crazy. Because, people that I know, and even people in our practice, we just have accepted the fact that, you're going to suffer when you do a detox.
No,
But you're explaining you don't necessarily have to have the headaches, the
no,
pimples,
no,
the breakouts, the stomach cramps, the
none
um
of it.
oh man, that is huge.
No. Yep. I
Okay, so
think a
that's
lot
a
of
big nugget.
practitioners, I think a lot of practitioners miss that mark, or people that are just try to go out there and do this detox on their own. There's so much information out there on the internet now. You can, Google best liver detox and kind of come up to try to make your own protocol. But this is how people get themselves into trouble. Not only, may they not be doing the right thing for their body, but they experience these horrible detox symptoms because they didn't go in the right order.
Oh, see, now that's really great information. Now, I've always framed it as you're just going to have those healing crises. It's part of the problem. I mean, it's part of the process. You're going to go through it. Don't stop. It'll pass.
Yeah.
But no, man, you got to really deal with the drainage pathways.
Yeah.
So this is fantastic.
Yeah. Think
So
about how wonderful that is. You could detox and not feel horrible while you're doing it.
I can't even imagine. Oh my God, this is like crazy. So what do so how can someone uh get what they need? Because unfortunately, you're all the way on the West Coast. Um, and the people that are probably watching this, we have some people on the West Coast, but most of us are on the East Coast. How can they get the benefit of this knowledge that you have? Because this is stuff that I think everyone needs to know.
Well, I have some good news for you. I work with all of my clients remotely, so it doesn't matter
Yay!
where you are. You could be in the UK and I could work with you. So they can contact me and visit my site at renewandreplenish.com. And yeah, we can start a conversation there.
So so if you're not aware, if you go to the show notes, Erin's information will be there. Her contact information is going to be there, and so you'll be able to easily reach her. Now, Erin, you talked about making sure you have the right vitamins and minerals.
Hmm.
Um, so how can people be sure that you know my vitamin and mineral? Oh, I take a multivitamin, and so I think I have it right. Is it something that, because I hear that all the time, I don't need vitamins. I'm taking it. I'm taking my over the counter with, my men's health
Yeah.
vitamins.
I think if you don't mind, let's back up a little bit and tell the people why are minerals even so important, okay? Because
Yep.
most people are like, what the heck are minerals? Doctors don't talk about minerals, right? You hear a lot about vitamins, but I think people miss the mark on minerals. So, minerals are super foundational in our health. And like I said, they almost always get overlooked by the majority of practitioners. Our minerals are involved in numerous bodily functions from building strong bones to regulating our blood pressure and our heartbeat. And they're super crucial for making our enzymes and hormones, as well as supporting the immune system and nerve function. And when we don't have proper balance of minerals, we start to experience symptoms. And these symptoms can range from anything like high or low blood pressure, heart palpitations, anxiety, joint pain, mood swings, insomnia, tooth decay. And I could probably talk to you for 5 minutes listing off symptoms, so I'll stop there.
Oh,
Um,
wow.
but you can see that many normalized symptoms that we might be experiencing could be coming from a simple mineral imbalance. And you asked me about, a multivitamin. Why not just take a multivitamin for this? And I think that's a really good thing to address, especially because I feel like most of us were taught when we were kids that you have to take your multivitamin daily.
Those Flintstone vitamins are really delicious.
I knew you were
Just
going to
saying.
bring that up.
How did you know? I mean, oh my God. And now they got the little gummies. Now,
I
personally,
know.
professionally, I do not recommend them.
No.
But please, Erin, continue. I'm sorry.
So the only time I really suggest a multi is when someone is extremely depleted, and we see that after testing. Other than that, I'm not a huge fan, and I'll explain why. So let's say I have a client who's eating their recommended daily amount or even over that amount of calcium. Then they go and they take their multivitamin that has 50% of their calcium recommended for that day. Now they have consumed anywhere from 100 to 200% over what is recommended in a day of that particular mineral. That same person only consumed, let's say, 3,000 milligrams of potassium that day. Maybe 300 milligrams of that was from the multi, but we need 4,700 milligrams in a day. So not only did they get too much of one mineral in a day, but they were very short of another mineral that they needed. And this plays out with not just these two, but many other minerals. So in the short term, over the course of a couple days, this isn't really a big deal. But if we're doing this daily, this is going to create a big imbalance. And the key takeaway here is that minerals always need to be in balance with each other.
Okay.
Maybe I should explain why they need to be in balance.
Yeah. So minerals need to be in balance with each other.
They do.
But what's the danger if they're not in balance?
Okay. So my favorite thing too, I'm going to use a little analogy to help make this really easy to understand. If you think of your body as a complex factory where each part of the body has a specific job to do, and our minerals are like little workers in that factory. Each mineral has a different role, and some may be responsible for building strong bones, and other responsible for carrying oxygen to the blood. Well, the factory only runs smoothly when all the workers are present and doing their job correctly, just like our body functions best when there's proper balance of minerals.
Mm-hmm.
If one mineral is in excess or deficient, it's like having too many or too few workers in the factory. It just disrupts the entire process. And our minerals often work together. So if one of those team members is missing or not contributing enough, the whole entire project, which is our body processes, is affected. Mm-hmm. So our bodies are innately intelligent. I know you know this, and it's constantly trying to keep this delicate balance, but sometimes it can't keep up with what we're putting in or not putting into it, and that's where we start experiencing these types of symptoms that I was talking about.
Yeah, that's really helpful. So the regular person who is eating, there are two types of people that I get to spend a lot of time with. It's the people who just are really uninformed when it comes to their nutrition, to the point where they're eating a pretty traditional American diet. I see them different as the ones that are my either keto people or my vegetarian people. I kind of see them in very different camps. Now, I'm assuming that you're working with the American diet people, the ones that eat the traditional hamburgers, french fries, and spaghetti and, mashed potatoes and that. And then you're dealing with the group that's vegetarian, I would think. They would be your clients. And you're also dealing with the people that are on keto or similar low carb plans.
I'm
Um, I'm sorry. Go ahead.
Oh no,
Is
I'm
there
I'm
more?
I'm dealing I'm actually working with everybody, even somebody like me who eats a very nutrient dense diet. When I
Oh,
did mine, I was not balanced. And honestly, that's because, due to the industrial farming that we have today, um, you know, we just become very depleted and we're not getting the minerals that we need to get or that we used to get many years ago, or our ancestors used to get through the food. I am definitely a food first approach to target minerals, which means, you're getting it through a balanced diet and a variety of foods. But sometimes it's just not enough. I don't know if you've ever used a tracking app for your food, but I use this one as an experiment on myself called Chronometer, and it shows your minerals that you're getting through your food. And I was
interesting.
shocked to see that every single day I was having a deficiency in my minerals despite eating, a very nutrient dense, colorful diet. I definitely do not eat the standard American diet. Um,
Wow.
so, everybody has room for improvement.
Mm-hmm.
It's not just the people that, you know, are eating the standard American diet. There's lots of things that deplete minerals from our body, including, like I said, the most obvious, which is poor diet. Um, but, second, the soil depletion. We've got stress. Long-term stress affects the body's metabolism and depletes us of our minerals, especially magnesium and potassium, which are both used in higher quantity when we get stressed. Aging, simply aging, which none of us can get away from because as we age, our body often becomes less efficient at absorbing nutrients. And, alcohol and drug use, excess exercise, unbalanced pH levels in the body, excessive consumption of caffeine or sodas. I mean, there's so many things that deplete minerals.
Oh, that's fascinating. And so it sounds like everybody can benefit. I mean, there is no
Everybody can
one that
benefit.
cannot benefit from knowing where they're lacking in minerals. Now, you were saying that you have a methodology for this, there's a testing protocol.
There is. I use what's called the HTMA test, that stands for Hair Tissue Mineral Analysis Test. And it's a really simple and non-invasive way to check your levels of minerals and actually toxic metals in your body over the last 3 to 4 months. And all it is a small hair sample, usually from the back of your head, and they analyze it at the lab. Then the test results are given to me and it gives me insight into your metabolic health, your thyroid health, adrenal health, all at a cellular level, just by showing me your mineral levels. And as a practitioner, this helps me to be able to design a protocol that is an exact blueprint of what that person needs for their body to be back in balance.
Now, I have very little hair on my head,
I see that.
so it would be difficult for me to give a hair sample, I think. But how long does the hair have to be, or can I use a mustache hair? I gotta ask.
They do
Maybe it.
actually take other hair samples from different places on the body. But my husband also has a, bald head, and he just grows it out a little bit and he just shaves it and takes that whole hair pile and puts it on the little
Oh,
scale and then they send it out. Now, for someone like you doing that, it won't be a picture of 3 to 4 months because we need an inch of hair in order to see 3 to 4 months. It would probably be more of a window of a few weeks.
oh,
But
interesting.
yeah, but you could also, like I said, you could take hair from other places on the body.
Yeah, I mean, well, my eyebrows grow really fast. And when you get old, seriously, you get one wayward eyebrow that you got to pluck anyway. So I might do
We need
that.
a lot
Or,
more than one eyebrow, though. We need about
oh,
a,
my bad.
a
Okay.
we need about a heaping teaspoonful of hair.
Okay, that's good to know.
That's so funny.
Okay. They don't got it here. So yeah. Well, anyway, I don't want to speculate on where I'm getting a heaping handle of hair for the test, but I'm really fascinated. I'm really interested in doing it. And so once you send the hair in, what's the turnaround time of getting those results?
Usually it depends on, the lab. They can take anywhere from 7 to 14 days to get me back the results. And then, my turnaround time is usually just a couple of days to deliver the report to my clients along with their
Wow.
custom protocol. You know, I think the unique thing about what I do is I don't just treat the paper. Your test results are very valuable and it helps me to create that exact blueprint of the supplements that you need. But I also consider the person. Someone's diet, someone's lifestyle, someone's medical history is so important to correlate to that test result. And, we don't get that in Western medicine at all.
I totally agree. I think, being aware of the whole history of the person, I mean, divorces and injuries and how they feel about exercise and nutrition, I think all those things matter when it comes to um, coming up with any protocol for them,
Yeah.
particularly vitamins or whatever it may be. I
Yeah,
mean, having that foundation, having that baseline for their life is, I find a very helpful thing
exactly.
to do. That basic assessment of, if you will.
Yeah. And giving them the education too, especially for my ones that are coming to me eating the standard American diet, showing them like, hey, this is where you have nutrient deficiencies. Let's start to look at other food options that might deliver you more minerals than what you're getting. I actually have a free handout for your listeners at therenewandreplenish.com. You can download it, and it is a guide as minerals as food. So it gives lists on which foods are highest in which minerals.
Oh, great. Okay,
Yeah,
that would be really helpful.
yeah.
So definitely go to the show notes because there are a lot of important information that you can get there when you go to Erin's website. So, Erin, is there, um, what's one question, Erin, that you wish I'd asked you, and how would you have answered it?
Oh, that's a really good question. I think you're so thorough. Um, I think that one question would be like, what role does the personalized supplementation play in my approach? And maybe that's, that personalized supplementation is just one of the pillars in my approach. I don't believe in cookie cutter programs or recommendations because we are all bio individual unique and we all lead different lifestyles, and that really needs to be considered. I use the functional lab testing, specifically the HTMA. I do other lab testing in addition to that. But for this particular package, for the minerals, I use that test to help determine what's right for each person. Because, like I said, it's not about treating the paper, it's treating the person.
I can't leave this interview without asking you something about oral hygiene since you have a background in dental hygienistry. Okay. Um, is there a connection between your vitamins and minerals and halitosis and tartar on your teeth?
Absolutely. There is. Um, Fun fact, so a lot of the, that tartar buildup that we get called calculus, so, your hygienist will tell you, there's a tartar buildup, especially behind the front teeth there. That's calcium. And a lot of the HTMA actually will show calcium that is not going into the bone and teeth. It shows it going into the tissues. And
Ah,
yeah, and the people that tend to have higher calcium amounts on the HTMA tend to have a lot of buildup in their mouth. And that's because they don't have sufficient vitamins, specifically vitamin K2 is a cofactor to push and shuttle that calcium into the bone and teeth where it needs to be instead of getting lost into the tissues.
Oh, that's
So,
fantastic. And the K2
yeah.
is usually in what, green veggies?
K2, yeah. Green
Okay.
veggies, green like kale,
Hmm.
spinach. Um, we have to use a much higher amount when someone comes back with a high calcium on their HTMA. You know, typically they'll be on a supplement for a while until we see that amount drop there. But
I'm looking forward to having mine done. I really am. And
yay!
so I definitely will be doing it. So one final thought that you want to leave with our listeners today is
It caught me off guard here. Um, always always start with your diet. So always start with the basics and the foundations of addressing your nutrition and your diet first. Take a look at that, download my freebie and see what kind of, food you're getting and what kind of vitamins and minerals you're getting through your food. And once you improve that, come and do testing with me. Let's get you optimized and feeling your best.
Erin Souza. Did I pronounce it right? No.
You did.
What's the background or the origin of Souza?
Portuguese.
Ah, nice.
Yeah.
Well, Erin Souza, thank you for joining us today. It has been really fascinating. I'm going to be doing the testing for sure, but I also want to thank you, listeners, for tuning into another episode of Your Health Moment. I look forward to talking to you again next week. Take care and bye for now.
Thank you.
Thank you. Oh, this was cool. Oh, I'm Erin. I cannot wait. This sounds so cool. I cannot wait to do my test. So I'll go.